welcome to medical science. As a student of medical science, I wanted to take clever every branch of science. What kind of things say do that is but that is knowledge, that is yes, and that is good, what that is as a Muslim, you always the one and only good to accept all vacation last time this person. Ya alif lam nam. Yellow shapi, yellow mapi, yellow kapi. Anar abdul mushil shapi, anar abdul mushil mapi, anar abdul mushil kapi. Now my friend is about a medical science class. What is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, data, by mathematical calculation, with proven with experiment. That is science. What is medical science? Medical science is the branch of science described elaborated about creation like human Homo sapiens. Now my friend Mr. We discussed elaborated about diarrhea last class. Now medical science described elaborated common disease. Those are commonly occur. We go to the common disease like TB. Disease like fever. Now you will discuss elaborated about fever. Fever, why fever come? And how you fever diagnosis? What is the reason of the fever? For identical purpose, if your temperature, body temperature equal more 99 degree Fahrenheit, if your fever body temperature 99 degree Fahrenheit equal more than 99 degree Fahrenheit, you consider you have fever. Not for weather purpose, sweating purpose, hot purpose on general. Now, if temperature remain that, those are my patients. You remain 8 box. What is the 8 box? 8 box remain medical equipment. What is necessary? That is the reason. Not only human, every family should have 8 box. By that 8 box, anything wrong occur, you can correct it. So my friend supporter, those are my patient. You take that. Remain in your home 8 box. If you have money, enough money. If not money, then when come? Now fever, in fever 8 box you found the thermometer. You check your temperature. Then you see that temperature. Now after you check your pulse. Your pulse is normal rate, but fever comes. Then the first day of the fever, early diagnosis of disease, first day of fever or pointing of the fever, hour, 1 hour before you remain good now fever. What is the reason? What do you eat? What you drink? What is smoking? And if where you go from that, and now in that fever, what is that fever? Either that injury occur in that in between time there is a traumatic injury occur. No. If traumatic injury not occur, how fever come? If traumatic injury or radiation not come, or cut injury is not occur, how fever come? Then that is infectious fever. What is the infectious fever? The infectious agent is, what is the infectious agent? Like bacteria, virus, parasite, fungus. Bacterial fever, viral fever, parasite, fungus fever, commonly on general. Then fever come, you go to the doctor, pulse remain normal one day, beginning of the early diagnosis of disease is necessary to, those are my patient, early diagnosis of disease. You, you have fever and you come, go to the doctor. Now doctor check your vital sign is remain normal, fever. What is the source of fever? Now doctor, you say the fever come. Then doctors say if you have for fever diagnosis head to toe, what doctor do? You have headache, you say no headache. You have eye pain, eye ache, acne pain, eye ache, eye pain. You can normally see everything. You say I can normally see everything. Then say you take a deep breath. You feel better? Yes. Then eye and in headache, no headache, cranium, head have no problem. Eye, I have no problem. Nose, nasal cavity have no problem. Not running nose, not not any infection now. You can take breath normally, not nasal congestion or nasal running nose. No. Now you see the earache. You have earache? No. Tinnitus? Any problem? No. Now go to the oral cavity. In oral cavity, you feel anything wrong? In tonsil, there is a swelling. There is a oral cavity. You feel pain? No. Now in trachea, you take a deep breath, and now raise the trachea in trachea place. Take a deep breath. You see that trachea root is clear. Now go to the head. Now chest. You see the heartbeat. Now heartbeat is normal. Pulse also normal. Blood pressure also normal. Now you see the lung area. Chest remain heart and lung. In heart, both heart auscultate. In front, behind. There is no problem. Now you go to the gut abdomen. You see the bowel sound. Bowel sound found the normal. Now you go to the limb. Limb sensation can walk and everything is normal, no pain. Now you say you have defecation or when stool come, defecation, or after toileting you feel pain, anything wrong, you have diarrhea. You say no, I have no diarrhea, no pain. Then you say, doctor say you have painful urination. In urine you feel pain. Then patient say, yes sir, I feel pain in urination. Now you understand that now the pain in urine, what is the reason? Now urine RME investigation. In urine RME you found the pus cell. Now urinary tract initiation, UTI, urinary tract infection. You see that feel the kidney level and kidney, and you know that from kidney there is a, you know that the, you see the feel the kidney area, bladder area, you feel the pain. The kidney area you not feel pain, bladder area you feel the pain. Then that is lower urinary tract infection. Now lower urinary tract infection, pain, lower urinary tract, in lower urinary tract there is a bladder and prostate, lower urinary tract infection. You confirm by urine RME. There is a pus cell more than 5. Now you see the bacterial culture discs. You say that who is antibiotic sensitive given. On general urinary tract infection, which antibiotic is bacteria you can give. Now you given hot drug. I given on generally ciprofloxacin. Those patients have no sensitivity about ciprofloxacin. I give them ciprofloxacin 500 milligram 2 times 7 days. But I say the patient take the first 3 days. If symptom reduce, if come follow up, then I see the everything normal 1 day more. That's enough. Ciprofloxacin. Those patients is not come follow back. Continue to 7 days. I cannot see. I don't know infection remain or not. Now by that policy, doctor take history head to toe. If you wanted to diagnose patient without investigation, you take history head to toe, toe to head, head to toe. That is the policy to take history, and your accuracy then maintain. Without investigation, you want to more accurate doctor. Without misinterpretation, misdiagnosis, you take history head to toe. Then you understand that. Thank you very much, my friend and supporter. Today is enough from medical science class.